Hello, and welcome to part 1 of skull anatomy. In this lecture, we'll begin by introducing some characteristics of the cranium and talking about specific parts of cranial bones. The skull is divided into two main sets of bones. We have 8 cranial bones and 14 facial bones. We'll discuss the 8 cranial bones in this first set of lectures, and we'll talk about the 14 facial bones in a separate set of lectures. The 8 bones of the cranium are further divided into 2 sets of bones. We have the calvarium, or the skull cap, and we have the floor of the cranium. And each of these 2 areas consists of 4 bones. So the skull cap, if you were to follow this suture line right here, if you kind of lifted that off of the cranium, that is the skull cap. And those 4 bones are the frontal bone, which you see in yellow, the right and left parietal, which is in green here, and then the occipital bone, which you see in blue. Again, if you were to lift that off the cranium, that is the skull cap. The floor of the cranium consists of the right and left temporal bones, which you can see in purple here, the sphenoid bone, which is in orange, and then the ethmoid bone, which is in blue. Okay, so those 4 bones make up the floor of the cranium. Okay, so let's review. What did we just learn? What are the 4 bones that make up the calvarium, or the skull cap? Remember, follow this suture, and you kind of lift the skull cap off the cranium. You have the frontal, the right and left parietals, and the occipital. 4 bones. Okay, so which bones make up the floor? Well, you have the right and left temporal, the sphenoid, and the ethmoid. Good. So I want you to pause here, and I want you to, on a scratch sheet of paper, jot down A through F for me. Okay? All right, good. So A is the frontal bone. B is parietal. C is occipital. D is temporal. E is sphenoid, and F is ethmoid. Okay, good. All right, so we identified the calvarium and the floor of the cranium. We identified that the floor is made up of the ethmoid, sphenoid, right and left temporal. In this diagram on the right, you can see we've kind of sliced the skull in half transversely, and we're looking down from the top. So here is anterior, because this is the frontal bone, and here is posterior, because this is occipital. So you can see the green is the parietal, the pinkish color here is the temporal, you can see the sphenoid and the ethmoid. So when you're studying cranial anatomy, I would really encourage you to use color to help differentiate the bones. Color may be helpful as you're learning. Of course, we know that the bones of the skull fuse to form a protective enclosure for our brains. And then in the next few slides, we're going to talk about specific details of each of these cranial bones, because of course, every nook and cranny has its own name. So let's begin by talking about the frontal bone. So the frontal bone, of course, makes up our forehead, and it makes up the roof of our orbits, or our eye sockets. And the frontal bone consists of 2 main parts: the squamous, or vertical portion, which forms the forehead. You can see that here and here. And the orbital, or horizontal portion, which forms the superior part of our orbit, again, or our eye socket. And I think you can really see that here, that it's kind of a horizontal shelf. All right. So there's a few parts that we should identify first on the squamous portion, or the vertical portion. First, the glabella. The glabella, right here, is a smooth and kind of raised bump in between our eyebrows, and it's just above the bridge of the nose. The glabella is really important for positioning, so we'll talk more about that in lab. Next, we have the supraorbital groove, or the SOG. And you can see that here. You kind of have one on each side. That is the slight depression above our eyebrows. So if you put your finger on your eyebrow, kind of run your finger up, you'll kind of feel that you kind of fall into a slight groove. That's your supraorbital groove. Interestingly, the supraorbital groove is approximately found at the same level as the top of our orbits, or our eye sockets. And you can kind of see, it's hard to see here, but the roof of our orbit is approximately the same level as the supraorbital groove. Okay, the superior rim of each orbit is called the supraorbital margin, or SOM. So that is basically the top of our eye socket, or the top of our orbit. And you can feel that with your fingers, right? It's underneath the level of our eyebrows. It's the top of our eye socket. The supraorbital notch, or foramen, is a small hole or opening within that supraorbital margin, and it's slightly medial. So let's look at that. Here's our supraorbital notch, or foramen. And I think you can feel that. If you gently, push on that supraorbital margin and kind of run your finger medially, you'll kind of feel that little notch. This supraorbital nerve and artery actually pass through that little notch, or foramen. On each side of the squamous portion of the frontal bone, above the supraorbital groove, is a larger, rounder prominence called the frontal tuberosity. So in other words, if you continue to go superior from the groove, you'll have this kind of rounded bump, which we know as our forehead. That is called the frontal tuberosity. Now, in case you're wondering, this supraciliary ridge or arch corresponds approximately to the level of our eyebrow. So you have your supraorbital margin, which is the top of your eye socket. Then you have the ridge, then you have the groove. Okay, if you're kind of working your way upwards. And remember, the frontal bone has a vertical or flat portion and a horizontal portion. And you can kind of see that better here. So I want to take off the frontal bone from the rest of the skull, and I want to look upwards at that horizontal portion. Okay, and that's what we're going to do in the next slide. So again, I've removed the frontal bone from the rest of the skull, and I'm looking upwards at this horizontal portion. So this is anterior, this is our forehead, and then of course this would be posterior. This orbital plate here, remember that corresponds to the level of the supraorbital groove, that little groove above our eyebrow that lies at the same level. This is the top, or the roof of our eye socket. So our eyeballs would sit right in here, okay, just to kind of orientate you. The orbital plate, as we know, as I just said, forms the superior portion of each orbit or each eye socket. Below this level are facial bones, and we'll talk about those in a separate set of lectures. Above the orbital plate is brain tissue. That's where our brain lives, okay? The orbital plates are separated from each other by this ethmoidal notch. So we have a right and a left orbital plate, and in the middle is this notch. Guess what fits in the ethmoidal notch? The ethmoid bone, which is one of the bones of the floor of our cranium. Now, the frontal bone articulates with 4 different cranial bones. You have the right and left parietal, the sphenoid, and the ethmoid. And we'll talk a lot about cranial bone articulations as we go throughout this lecture. Okay, next I want to talk briefly about the parietal and occipital bones. The parietal bones, remember, form the outside or the lateral walls of the cranium, And remember, they're part of the roof or the skull cap or the calvarium. So the parietal bones are seen here in green. The parietal bones are roughly square-shaped, and if you were to look at them from the inside, they have a concave internal surface. The widest part of the entire skull is actually located between what's called the parietal tubercles or the parietal eminences. And again, just think of that as the widest part of your skull. The frontal bone is anterior to the parietals, which you can see here, the frontal bone here. This is anterior, this is our nose. The occipital bone, of course, is posterior. This is the back of our skull here. The temporal bones are below or inferior to the parietals. And here's our temporals. Each parietal bone then articulates with 5 different cranial bones. Okay, so the frontal, of course, the occipital, the sphenoid, which you can see here. See this articulation here, and then the opposite parietal. So the right parietal articulates with the left parietal, so that is counted as an articulation. So each parietal articulates with 5 different cranial bones. Okay, a few words about the occipital. So we know the posterior and inferior aspect of the skull cap is formed by the occipital bone. And here we are looking from the bottom of the skull upwards. So here is anterior, here is posterior. Just to kind of orientate yourselves, again, we're looking from the bottom up. The external surface of the occipital bone has a rounded, flat portion called the squamous portion. And the squamous portion forms most of the back of the head and is part of the occipital bone that lies above the inion, or the prominent bump at the back of the skull. The large opening at the base of the occipital bone, through which the spinal cord passes as it leaves the brain, is called the foramen magnum. The foramen magnum literally means great hole. On each side of the foramen magnum, notice there are 2 condyles, and they are oval processes with kind of convex surfaces. What do you think these condyles articulate with, if you had to guess? Yes, these condyles articulate with the first cervical vertebrae. And this articulation between the skull and C1 forms the atlanto-occipital joint. Okay? Remember that C1 is also called the atlas. All right, so the occipital bone articulates with 5 different cranial bones. So both parietals, both temporals, the sphenoid, and then it also articulates with C1. So it's classified as articulating with 6 bones, but only 5 of them are cranial bones. Okay, we're going to pause here. We'll pick up part 2 with a discussion on the temporal bones.